Good afternoon and welcome to today's afternoon edition. My name is Isa Nu. As you always know, every day we come up with issues that bothers Nigerians, and definitely for us to be able to discuss in details what these issues are and how we can find solution to them. But then recently we've noticed that there have been a series of issues, most especially health issues as it concerns malaria. Malaria is a life-threatening disease spread to humans by some types of mosquitoes, and it is mostly found in tropical countries, of which Nigeria is one of them. And it is preventable and curable. The infection basically is caused by a parasite and does not spread from person to person. And according to the latest World Malaria Report, there were about 249 million cases of malaria in 2022 compared to the 244 million cases in 2021, and then the estimated number of malaria deaths stood at 608,000 in 2022 and compared to the 610,000 in 2021. So the World Health Organization African region continues to carry a disproportionately high share of the global malarial index. And in 2022, the region was home to about 94% of all the malaria cases and 95% of the death. Children under the 5 years of age accounted for about 78% of all malaria deaths in the region. 4 African countries accounted for just over half of all malaria deaths worldwide. Nigeria recorded 26.8% and Democratic Republic of Congo with 12.3%, Uganda with 5.1% and Mozambique 4.2%. So each year, the WHO World Malaria Report provides a comprehensive and up-to-date assessment of trends in malaria control and elimination across the globe. So this year's report, which has to do with the 2023 report, includes for the first time a dedicated chapter focused on the intersection between climate change and malaria. So as described in the report, climate change is one of the many threats to the global response to malaria. Millions of people continue to miss out on the services they need to prevent, detect, and treat the disease. So conflict and humanitarian crisis, resource constraint, reduced constraint, and biological challenges such as drug and insecticide resistance also continue to hamper the progress. So taken together, these threats are undermining gains in the global fight against malaria. Today, our conversation will center on the SMC, that's the malaria. SMC basically stands for Seasonal Malaria Chemo Prevention. That conversation will definitely be discussed by one of the spokesperson in that particular public health department, of Mr. Pascal Ugu, who is here with us in the studio. He will be joining us just after the break to tell us more about the programs, the awareness that is being created by the SMC. So let's go for this break, and when we return, we start up with the conversation.
The welfare of millions of people for generations to come may be affected by the wisdom which we here display. If Nigerian leaders and our British partners are to prove themselves worthy of their trust, now is the time for us solemnly and truly to dedicate ourselves to seeking the greatest good of the greatest number of our people in Nigeria. Independence for Nigeria in 1960 is imperative. But independence for Nigeria as a corporate entity is not enough. The peoples of Nigeria must at the same time be guaranteed their freedom. We must ensure that in an independent Nigeria, individual citizens throughout the land enjoy liberty, human dignity, and equality under the law. There must be one Nigeria with one constitution and one law for all. Let us therefore, Mr. Chairman, sir, close our ears to the counsel of despair, which says that we cannot here at this conference agree on a constitution. If there's any doubt among us as to what should be written into the constitution, let us, as Democrats that we profess ourselves to be, refer such problems, as the Gaulle has done recently, to the people whom we profess to represent, either just before or at the federal elections late in 1959. The welfare of millions of people for generations to come may be affected by the wisdom which we here display. If Nigerian leaders and our British partners are to prove themselves worthy of their trust, now is the time for us solemnly and truly to dedicate ourselves to seeking the greatest good of the greatest number of our people in Nigeria. Independence for Nigeria in 1960 is imperative.
Welcome back from that short break, and just before the break I told you we are going to be having Mr. Pascal, who is a public health officer, for us to be able to have this major conversation with respect to malaria. If you remember last year, I was able to pull out Professor Y.K. Ibrahim from Faculty of Pharmaceutical Science, Ahmadu Bello University, as at this particular point in time, to tell us more about the issue of malaria and the possibility of the vaccine. But today, we are looking at the seasonal malaria chemotherapy. Seasonal malaria chemoprevention, which is one of the recommended means by the World Health Organization in trying to see that, yes, we kick malaria back to where it belongs. But then today we are having Mr. Pascal Ogbu, who is a public health expert, and I want him to brief us on the status of our malaria challenges we are having. What do you think we need to do with our current challenge? Because so many persons are now complaining of malaria. When are we going to have a stop? Myself, I had to treat malaria within the span of 2 months. I had to treat malaria for up to like 2 times. So what is actually happening?
Okay, good afternoon, listeners. My name is Pascal Ogbu, Head Promotion Officer, Public Health Department. So, from what you said, we are in the season, because every year at the peak of rainy season, we always have high number of malaria cases, and this is caused by the mosquito that trend more during the rainy season. So this is why it becomes an issue, because at the peak of rainy season, when these mosquitoes, they lay egg, they hatch, they multiply in numbers, they find their way into our homes. You did your own treatment twice in 4 months, but many people are treating malaria almost every week, because once these parasites enter your system, you eventually break down. So that is why it is an issue, and that is why we are on this program, SMC, which is Seasonal Malaria Chemoprevention. This is the administration of drug, preventive malaria drug, to children 3 months to 59 months. Why is it this age bracket? Because you discover that these children, their immune system is still coming up. There is not that strong as that of an adult. Just imagine at this time where you are treating malaria, you know how you feel, you know what goes on with your system. But these children, their body is still so tender. You can imagine what will be happening to them. So that's why this program was initiated, whereby these anti-malaria drugs are given to them, and it will help reduce the severity of this malaria once they get down with it.
But if you look at the way the issue is now, and because even myself at some point I was scared, it's been long. I treated malaria within a very short period of time, and I was looking at, is it as a result of my immune system and the rest? So should it be a thing of a cause for alarm?
No,
for Nigerians to be able to say, we have to just nip this in the bud.
So as I said earlier on, at the peak of rainy season, you find these mosquitoes everywhere. Good. Some lifestyle, like when you stress yourself, it can, and when you don't feed well, your immune system might get low, and the severity of the malaria might go high. You understand? So, like now, you now that treated the malaria within a space of, you stress yourself. When you stress yourself, the body is not wood now. You understand? So when the parasite introduced into the system, you discover that combined with the stress and everything must eventually come down.
Yeah, actually, I did agree that because the last one I treated, I actually stressed myself, and I understand that.
Okay.
But then, in this particular case now, where we now have this issue to be seasonal, and we know that yes, this issue is a seasonal issue. Before the season, are there things we need to put in place in order for us to reduce this particular mosquitoes? Yeah.
Okay. Thank you for that question. You know, these mosquitoes, they survive more in dirty environments. When you leave your environment dirty, when you leave stagnant water, you don't cut the bush around your house, you discover that they find a place to hide. But when the environment is clear and is very clean, I don't think the survival rate will be reduced. So before the onset of all this, you know, let's assume rainy season comes with green, everywhere turns green. But when you continually clear the environment, clear the bushes around you, make sure that there's no breeding place for them. Because when you leave stagnant water around the house, you will see that they come to lay egg inside and they will multiply. So one of the measures will be to maintain high environmental sanitation. And also, if you can use nets, you can provide nets for your household, then make sure that you cover everywhere appropriately. Because when you leave, people use door nets in their homes in order to reduce how mosquito enter and leave the house. Others sleep under mosquito nets. So those are the measures that you can take before this period. But in this case now, we are talking about in children. So during the peak of rainy season now, this program is initiated, and these drugs, we have 5 cycles within this peak of rainy season. We are done with the first cycle, we are on with the second cycle now. So this drug is given to these children to build and boost their immunity against this malaria parasite. So those are the things you can do normally.
Okay, what about for a pregnant woman, despite the fact that yes, she has not given birth, but she has a baby inside, a healthy baby? So is it the same drugs you are administering to these people?
No, the drug for now, yes, there are anti-malaria drugs that a pregnant woman can take.
Does the SMC covers this?
No, this SMC
is basically
for now is for children 3 months to 59 months. That's the provision that have been made for now. Maybe in subsequent years, maybe a provision will be made for adults. But as for now, for it to reach to be enough for the people that it was brought for, it's just for this age bracket.
For clarity's sake, when you say SMC, that's seasonal malaria control,
chemo prevention.
At what point did you people started this program? And
okay.
How successful is it so far? And have there been any question of the credibility of what you people give out?
Okay, so this program, because you know malaria is endemic in Africa, especially in Nigeria.
Sub-Saharan Africa.
Yes. So around 2012, WHO came up with this initiative. How do we reduce the rate of mortality caused by malaria? So that's how this program came about. But in FCT, it started 3 years ago. But this program has been on for a while. So this SMC came on because of the need to curb the mortality, especially in children. The need to reduce the mortality in children. And since the program started, well, the success rates have improved over the years. You know, so you know this mentality of people, I don't want my child to take this, I don't know what it is. But you discover that over the years, as time goes on, they saw the importance of this drug. You know, some homes you enter, because we have a team that goes around door to door to distribute these drugs to households. So at a point when you reach some home, they will say, we don't need this. So, but as time went on, malaria, you cannot prevent it. When your child gets sick, maybe you hear from a neighbor, oh, my child took this, and the malaria rate have reduced. Then over time, people started adopting it, and people started accepting these healthcare workers into their home.
But then, when it comes to the issue of the acceptance, and then looking at, for instance, let me say the symptoms now, so I'm not acceptance. At what is it when the child has started exhibiting symptoms of having malaria, or give them before?
No. Yeah. So this SMC drug, the drug's name is PAC, sulfadozine and amlodipine. So this drug, you don't give it to a child that have malaria, or a child that is treating malaria, or a child that have treated malaria, take a malaria drug maybe in the past 1 week or so. So this drug is given to eligible children who are not sick. Any sickness of any type, you don't give the drug to the person. So you don't wait till not when the child gets down with malaria. It's treatment that you give. SPAC is not for treatment of malaria. It's for prevention of malaria in these children.
Okay.
Yes.
So, but in the FCT now, where do you think we have the high amount of people affected by this particular disease?
Okay, by malaria.
Yes.
So you discover that like the activity is ongoing in all the area councils now, even in the city center. So mostly malaria is everywhere. You cannot say, I'm staying in the city, I will not have malaria. But even in the outskirts of the town, some villages around, because of the kind of environment they find themselves, you see that the malaria rate is higher there. Like some places that around FCT, you discover that because of the poor sanitation around that environment, you discover that these mosquitoes tend to survive more in those areas. So it is carried out everywhere, but still the focus is always on those villages around. But this program is carried out in the whole of FCT.
Okay, in the whole of FCT, but then you guys have been here for like 3 years, just like you rightly stated.
Yeah.
So in this particular case, you should be able to have probably maybe data to actually tell that, okay, in this particular area council, but then still on this particular issue, looking at the way things are going now, and we've also raised the issue of now we are now having climate change. And as a result of that, we're also seeing that there's a correlation between climate change in sub-Saharan Africa and then the rate of malaria impact also in sub-Saharan Africa. Looking at these drugs that you give, if you go to some houses now, looking at the economic situation, things are difficult. Now you are providing these drugs, and a situation whereby you notice that a particular house that you've been to, probably you didn't meet anybody there. But there is an information that, okay, somebody gave back the person has stayed for like 3, 4, 5 months within your range that you want. You went there, you didn't find the person. How will you be able to trace and get this person to see that, yes, the child takes the drugs? Okay,
so like these teams now that are going around, there is always a house marking in each house you visit. So when let's assume you go to a particular house and there is an information that there is a child there, and you don't find the child, you have to revisit the house.
So a situation whereby
you have to revisit. Then in a house, if you go to a house and they say that they have 3 children under the eligibility range, so and 2 of them are not at home and you met only 1, there is a marking that you put there, and you still come back to give the remaining 2 anytime they come back within the period of the implementation. That's the 5 days, 4-5 days, because each cycle is made up of 4 days. This one now started on Friday, and possibly it will end today also. So you must go back to give the child.
So what about if it is a working mother who goes out early in the morning, comes back in the evening, and you guys work mostly during the morning period until the afternoon?
So the thing there is that the team is made up of there is what we call a lead mother. So a lead mother is somebody that stays in that particular community. Do you understand? So it is the work of this lead mother now to make sure that that child takes that drug, even if it means going back in the evening when the mother will be back. It is now the work of that person to ensure that that child is reached and that child takes that drug.
Are these drugs available in the hospital?
No, for now it's not available. Even in the pharmacy, you can't find it. It's not for sale. The drugs are free.
But there are government hospitals, there are primary health centers, there are secondary health centers where they will need drugs like this.
So
those are the places some of them come for vaccination and the rest of it like that. So don't think that is even a very good meeting point, and why it's not in the hospital.
So for now, you only find this drug during this period. Do you understand?
But then during this period, people also go to the hospital.
We don't have, initially, there used to be feast posts in health facilities where you can go. If you don't, if those people don't meet up coming to your house, you can go to this feast post. But for this year, there is nothing like feast post. So you just have to find a way to reach them, or they find a way to reach you.
But in this particular case, the government, was it the government that approved these drugs? It's just you.
So the drug have been approved by World Health
Organization.
Yes, as it meets the standard, all the requirements, it has been approved, and it's safe and reliable to take.
Okay, moving forward, which other states apart from the FCC are you discovering?
Okay.
How many states?
Like 9 states. It started with 7 states, but now it has increased to 9. We have places, plus FCT, Kogi, Zamfara, Sokoto, and other states. Yeah.
So how do you get your staff? Are they staff of your public health department, or you get them, if they are ad hoc staff, how do you get them to see that yes, they go into this local community and provide this service?
Okay, thank you for that question. No, public health in collaboration with Malaria Consortium are together in this process now. So this, at the beginning of each cycle, or at the beginning of each year, there is a training that is being organized for people that will take part in this program. Like in health facilities, most health facilities in all the area councils will provide people that will be trained on how to administer the drug and how to go about on the distribution of this drug. So that training covers the dosage you should give, and how to do house marking, and in all the area councils the training is being organized. So it is now those people that have been trained that will go into these communities. You know, we pick people from that community that knows the nooks and cranny of that community, that knows where to find so person and so person. Now it's not the work of that person to go around. And before this program starts, a training is being organized also for announcers that will go around and inform people. Like in the instance you gave of a mother that works till evening, there is an announcement that is being done before the commencement of the program, in which everybody is made aware. Everybody is made aware of the program that will be coming up, and an appeal is made to make that child available within the space of within those period that this program will cover, so that each child will get his or her own drugs. So this training covers for those announcers and the people that will still go back and give these drugs.
So you said that this particular SMC administration runs within cycles. How are the cycles like? Is it monthly? Is it quarterly?
It is monthly. So the first cycle finished last month. So in an interval of every 28 days, it's been the second cycle. Like this second cycle we finish now. The next cycle is expected to start maybe in the next 28 days.
Are you getting backlash from people with respect to them not actually knowing this? And probably, yes, I know you've created so different platform where you enlighten people about this particular SMC.
Yes.
Have you ever gotten backlash that, look, we don't want this, your drugs?
Of course. You know, people are entitled to their own opinion, and various people with their mentality. Sometimes as I said earlier on, you visit a household, they will tell you that they don't want the drug, that they are not interested in it. Now, it's now left for you to know how you follow them, because you know that the drug is for the benefit of the child. Now, you cannot just go to a house and they tell you that you don't want it. You just have to know the tactics you employ to convince the caregiver that this is the importance of this drug and why it's very important for that child to take it. So there have been cases where people, even after much sermon and preaching, they will tell you that they are not still interested. You can't force the people. You are not the owner of the child. Once the parents say refuse and say they are not interested, you just have to find another
Is
means.
it orally administered or?
Yes, this drug is orally administered. It dissolves in water. So for children that are around 3 to 11, you can use spoon to give the person. While you can use cup, you put it and add little water for it to dissolve. Then you give to the child.
But then, all through that you guys started this particular project, have you gotten feedback with possible reactions to these particular drugs?
Of course, the body system reacts differently. Once you introduce something that the body is not familiar with, it must react. Same case with when a child takes immunization. Something like fever, some of them have headache and all those. So some people, we have seen cases where some people complain that the child develop fever. Sometimes it brings out those symptoms of malaria when you take it. Some will even vomit because some children are allergic to sulfur. You understand? So some of them, when there's a case at one of the communities I went to on Saturday, they said the mother have refused because in the first cycle, the child vomited the drug and they reacted to it. So when they came around this second time, she said she doesn't want it. So these are different reactions you get when you take the drug. Some of them are just normal. Once the person has fever, it will just go away in a minute. It doesn't last. In some minutes, it might take a day or half a day, but the fever is not something that, unless the effects develops into another state, that's where you become worried or maybe seek help from the nearest health facility.
Seeking help from the nearest health facility, from a drug the SMC administer. In this particular case, then who will now take charge of?
So you are going to that particular, maybe the fever developed into another thing. You just have to maybe go and run some tests and know what is happening to the child. Understand? So this one now is now on your own. You just have to settle it.
It's debatable because people will say you are administering drugs probably through not the hospital, and this person is having an adverse reaction.
So the thing is that
are you saying that it is not a must for somebody to actually allow their children to be administered this drug?
So let me just chip something in this last question.
Yes.
So there is a referral form that will be given in case of any adverse effect, adverse reaction that comes up from this SMC. It is now with that referral form that you take the child to the health facility. You understand?
Okay.
So when you go there, they take it all from there.
So what is the number of days for this particular SMC administration in one particular cycle?
Okay, so it normally lasts up to 4 days. For maybe the 5th day you can do mop-up or collation or anything, but it lasts up to 4 days. Like it starts on Friday, Saturday, Sunday, and ends on Monday.
Monthly, that's how you guys will be doing?
Yes, for the 5 cycles.
So when somebody misses one particular month, are there any implications?
When you must have taken it, but it's advisable that you take all the cycles. You understand?
Just like the COVID-19 first shot.
Yes, it's very advisable because most of this drug works in a chain. This thing, you just have to take the first one and make yourself available for the second one, because you will be informed when they first come to your house that this is how it will run, and you should make your child available. If you have any excuse to give them, it's not left for you to tell them, then they will know how to take it.
So basically this whole process is about preventing the malaria, or treating the malaria.
It's prevention. Malaria prevention It's not SPAC is not for treatment of malaria. It's for malaria prevention in children, eligible children.
But there's tendency that even after the prevention, maybe with time, if the person probably, even if you complete the 4 cycle, there's possibility that you can also get.
Of course, it's still with us now, but maybe the severity will be reduced. Yes, you know, some people when they come down with a sickness, it might not be the same way you will come down with the sickness. It varies with the immune system. So I might come down with headache and I'll just be doing like I want to die. You might come down with headache and you still work with it. So it's here with us. The only thing is that you have to keep yourself safe from getting bitten by these mosquitoes.
But so far, how many of these area councils have you successfully covered in terms of this particular prevention?
Okay, just as I said earlier on, the program is ongoing in all the area councils, even Abaji, Wale, Gwagwalada, Kuje, all is ongoing now, and so far so good.
You've covered these 6 areas?
Yes.
Okay, but now moving forward, looking at the status of malaria in Africa, and most especially as it concerns Nigerians, what better advice would you give them in terms of making sure that yes, the issue of malaria is reduced drastically? Because looking at the death toll of about 600 plus, yearly is not the best coming from malaria.
Okay, so you know, malaria is something that has been with us. Just as when COVID came, they say, it's a strange disease, we've not witnessed. But malaria has been with us right from time. Right from when we were children, used to suffer malaria up to now. So it doesn't respect any age. It comes to every. So the best thing to do is that there are, apart from these drugs that are given to children, we can, as I mentioned earlier, keep the environment clean. At least for now. Because malaria, all these mosquitoes survive more in dirty environment. So if you are somebody that leave bushes around your house and stagnant water and all those things that will make those mosquitoes survive more, you have to find a way to reduce it. Clear your environment, dispose waste that will bring about mosquito visiting your home, and by that I believe that the rate of malaria in this country will be reduced.
Thank you so much, Mr. Pascal.
Thank you
for joining us today on the afternoon edition. It's nice having you, but I've listened on several accounts about the program on ASO Radio, and for the viewers out there, you can always listen to ASO Radio 93.5 to also get more information, because I think weekly they do have a program on this particular seasonal malaria chemo prevention. And then we hope and we pray that yes, we continue to battle malaria till we get it out of our society. It's not the best when you look at the cost of medicine.
It's
very, very
it's on the high side.
And we hope and the Ministry of Health will be able to do more when it comes to programs like this. It's nice having you once more.
Thank you.
Pascal.
Thank you.
How far we can go today on the afternoon edition discussing the seasonal malaria chemo prevention. It's very, very important because yearly we have the malaria report, and for 2023 definitely we've seen that the increase in malaria impact in Africa is something that yes, we all have to put our hands on deck and see that yes, we solve it. And malaria is not good for us, so we have to make sure our environments are clean, and also we make use of a mosquito net where possible, and probably get a mosquito repellent in our homes. These are things that will definitely help to reduce the impact in our society. My name is Isanu. Have a wonderful day and stay blessed.